Well, good morning and welcome to the October board update. It was a bit different this time. We travelled up to Rawene and spent time with Hora Hokianga, who are the health provider that we contract and fund to deliver health services for the Hokianga. So we had our board meeting at Rawene Hospital and got to spend some time walking around and talking to some of the staff prior to the board meeting. Had a lovely pōwhiri and then a visit to what is now a largely refurbished hospital. And I've got to say they've done a spectacular job refurbishing and also modifying the hospital. It's in a circular ward and has fantastic facilities, which is full credit to them. And it's all built within a very old building itself, but seems to have really good bones, and they've done a great job and plenty of space and really well designed. So fantastic credit to them and made us somewhat envious, particularly all of us who either spend time in Kaitaia, Dargaville, even parts of Bay of Islands and certainly Whangarei Hospital. So something to work towards ourselves, and I will talk to that a little bit later. The board meeting itself was commenced with some time with the Hokianga Health Enterprise Trust and the trustees themselves, and they talked to us about some of their needs, and then we went on to have the board meeting proper, both the open board meeting and then the closed board meeting afterwards. And I'll talk to you mainly about the open board meeting, but some of the issues discussed in the closed section as well. So we started with a paper on institutional racism, and I thought I'd just explain institutional racism a little bit, because the word racism sort of seems to apportion blame and personal accountability, and we all are accountable, but this is not about saying that any of us are racist, but that the system that we work within inadvertently disadvantages certain ethnic groups, so races, and so the definition that I'd just like to read out is reasonably clear, and then the position statement from the board is really directed at we're going to do everything we can to address these issues within the system itself. So institutional racism is an organisational system that creates differential access by race to services and opportunities, characterised by advantaging one part of the population over another, either by action or inaction. So acknowledging that and working on the system, working on ourselves as well, certainly on our te reo, on our cultural awareness and training, attending engaging with Māori courses and other courses to upskill and understand the differences in culture and how we behave and how we can improve how we behave and how we can engage with our Māori patients. And largely for us it is Māori, but we do have a growing Pacific population as well. So I think it was really useful. It's gone over the last two board meetings as the board debated and strengthened the policy and the statement, and so that's now been approved and will be available for you to have a look at, along with other position statements which we have on alcohol, fluoride, etc. And we will be developing some others as well, and they'll be available for you to see on the intranet. We had a paper on the Northland Health Strategy, and there will be plenty of opportunities for you all to feed into this prior to Christmas, but there'll also be some specific meetings to engage with you and get your input. This needs to be your plan. The last time we did the health services plan, it was more directed at community services, and many of the solutions are in public health in the community, while we continue within our hospital services to cope with the extra demand. But there's certainly a number of things within the hospital and how we work that need to be included in the plan, and so this plan will be much more, I think, a broad plan, and it'll be developed with you. So really important that the health sector has a lot of input, but also the community and consumers, and so quite an opportunity for us to develop our next long-term health plan. Otherwise, we lurch from one year to the next without any strategic direction, and it's pretty important that we do have those longer-term goals. We're very mindful of the Health and Disability System Review. The first report has come out. I may have mentioned this last month, and it's a long document of over 300 pages, but there is a 30-page executive summary. That was outlining the findings of the reviewers, and the next phase is at the end of March, a report on what are the recommendations and actions that should be taken for the health system, and that could extend very broadly, and so it's important that we take that into account when we're looking at our health services and health system plan going forward. So we will not finalise this until after we've seen the report and included some of those recommendations within it and taken those into account. Okay, we had 3 patient stories, a couple of really positive stories from Whangarei and Kaitaia Hospital, and then a complaint, and it's easy to understand how this happens, and it was from a relative who lived in Australia and was trying to get information on their sick relative in Whangarei Hospital, and unfortunately, because the next of kin was also in hospital coincidentally at the time, the relative really struggled to get some information. Our team corrected that and got back to them, but you can understand, and it's really important that we have these privacy policies, because in some cases, and our Chief Medical Officer outlined one where he'd been involved in England where they've got even more unscrupulous media, and something quite terrible had happened, and a media person, a reporter, she pretty much faked the assertion that she was a family member, and unfortunately those sorts of things can happen, but even less egregious actions can result in inadvertent privacy breaches. So we do have to be careful, but it is also about sharing information appropriately, so that balance is important. Just to point out, with the recent security breach, there's been some consideration of the fairly regular, in fact extremely regular attacks on our IT systems that we receive, and we're very fortunate to be protected very well through Health Alliance, and millions actually of attacks do occur on our system, and we have very good security systems, but we have to keep being vigilant over those, and we also need to work with our PHOs and other contracted providers to ensure they have that same level of security. Further information on progress with Mahitahi Hauora, and they've been doing a lot of work around GP workforce, and also working, which is actually, as you may be aware, a significant crisis both in Whangarei and Kaitaia, and I will use the word crisis, and so recruitment of GPs, but also the use of other parts of our workforce to supplement that are critical to that, and so there's been a action plan drafted from a number of different meetings, and so I think there are going to be some really positive actions from that, and it's critical that we do have adequate access for our patients to general practice, and particularly that otherwise influences significantly the demand within our hospital services. They've also commenced work on 3 localities, one across the mid-north, which is focusing particularly on mama and pepe, so the first 1,000 days, 5 years really of life, but particularly that first 2 to 3 years from conception. So a really important area of focus in that area. In the North Whangarei region, there's a focus on kaumatua and kuia, long-term conditions and frail elderly. And then in the South Whangarei and Kaipara, there's a focus on youth, rangatahi. So 3 different localities and a lot of community and provider engagement working there. And basically the concept is to have a joined up system approach across those 3 geographic regions, networking general practices and working together, but also working with the various multidisciplinary teams that we have both out in the community and some of our hospital teams as well. So that teamwork, that health and social care coordination and improvements there. And we're going to see greater improvements with mental health funding for primary care, which is going to be quite significant and will add extra capacity to general practices and the community and for Māori health providers as well. So some pretty exciting times around some of the growth and the over $600 million that was announced in the latest budget, with a large amount of that going into primary care and community care. Healthy Homes Taitokoro has recently won a significant award. It's called the Spirit of Services Awards from the State Services Commission, and both won their category award and the Prime Minister's Award, which is the overall award. And this was recognising the amazing work that's been done in a collaborative manner between PHO, the DHB, the Foundation North Trust, ECA and others who have co-funded this over a number of years. 10,000 homes have been insulated, and it really is a fantastic achievement with more to come. And it's an interesting model where a relatively small amount of funding can then generate significantly more from various other funders, and so that's been something something we're really proud of. And as we all know, healthy homes and dry, clean and spacious homes can create probably more health benefit than many other of our health initiatives. So a fantastic initiative that's achieved an awful lot. From a financial point of view, we're slightly over budget. Our unapproved budget with the government is $12.8 million deficit this year, and we're tracking a couple of $100,000 over that over the first 3 months of this year. So we're hopeful we can meet that budget. We did meet our $7.5 million budget deficit last year, but then there were a number of other incidentals which are not counted in our operating budget, but the Holidays Act pay and some write-downs of a couple of national systems also contributed. But our actual budget deficit was met last year, and so we do aim to meet that again this year. But you will note there's a significant increase in that budget, and that's partly because we received less new money this year than last year, which is the swings and roundabouts that you see within population-based funding. Having said that, the recent 2018 census results are out, and as you know, there's been a lot of publicity about the online approach and the deficiencies from that, but they've done a heck of a lot of work combining other what's called administrative data, which is other databases such as PHO databases, etc., to get actually what appears to be a very accurate picture. It's shown that Northland over the last 5 years, from 2013 census to 2018 census, growth grew faster than any other district or region in the country, and at 18.1% growth over that period, it was just on 3% higher than the next closest, which was Bay of Plenty. So obviously that certainly drives significant demand. We've looked at the next level of that data and have discovered that over 2/3, probably closer to 70 to 75% of that growth is in our Māori population, and then the other high category is in non-Māori over 65. So the Māori population growth is younger, but there is high growth in the non-Māori over 65, which probably neither of those categories surprise people who've observed this population growth over the last few years. That should translate into additional new funding. A lot of that we are receiving and have received and acknowledged over a number of years. So we, as you know, we have grown really significantly. Of course, demand always seems to outstrip our funding growth, but I'm also hopeful that over the next couple of years we will see significant further funding growth from that data. Unfortunately, probably that 2018 data, which is only preliminary at this stage, will not be used for next year's funding. So we're hoping that we will see as fair a funding allocation next year as possible, and I'll certainly be fighting for every cent that we can get, which is something I've always done. Measles, I think you're all aware, has been a significant challenge for us. We're up to just on 80 cases now, and there was discussion at the board regarding our approaches to measles, and as you know, we are offering vaccination for all those under 30 and between 30 and 50, those who are required or need to for clinical reasons, or teachers, early childhood care workers, or frontline staff in health. So we are vaccinating, I guess, in similar categories to those within the Auckland region, apart from the lowering of the 15-month age category to 12, which we're not doing, or even further down to 6 months. So we're sticking to that program, and we actually have a similar incidence of measles in Northland to both Auckland and Waitemata DHBs. Obviously, Counties Manukau has the lion's share and has much higher rates. So a significant challenge for our staff. I want to acknowledge everybody who's been involved either in contact tracing, immunisation, or support of that program. There's been an awful lot of work, and I know that it's a very challenging time. It does appear to be waning slightly in Auckland, and so we're hopeful we will see the same, but have had some recent cases which appear to have come from Northland per se rather than from Auckland. I want to acknowledge our mental health and addiction services, and we've got a program underway, which is a primary mental health program, part of Heara Oranga, which is the mental health and addiction review, and so that's a proposal which will be in before the end of this month to government for a significant increase in funding and resources, which I referred to before. Obviously the strikes, I just want to acknowledge the impact on all staff, whether you're actually within one of the groups who have been striking or one of the many staff who've been covering. I just want to acknowledge that I know it's tough on everybody, and it's also really tough on our patients. So really hopeful we'll get resolution, but in the meantime, just thinking of all of you and also our patients, and do hope we'll be able to get on with providing the care we need to. And I want to acknowledge how much contingency planning has gone into this to keep our patients safe. We discussed other items within the board meeting, particularly how busy the hospital has been at times, and then the fluctuation that can occur where it's really hectic and then suddenly is much quieter, and how we can predict, I guess, some of that extra busyness and preempt that by maximising discharges, etc. And some of the work that's going on, I think, is great around that, and predicting some of these really, really busy times is critical to reducing the overall overload within the hospital, and particularly emergency department. There's been a number of risks that I talked to the DHB about, certainly the patient safety risks around hospital overload and how busy we are and the overcrowding within ED. We've also had some challenges with our helicopter service, which many of you will be aware of, and this has been to do with the regionalisation of the service and our Nest helicopters. And we've been pretty lucky over the years to have a really very good service from Nest. Have been required in Auckland some of the time, and so at times we've not. Unfortunately, we haven't had helicopter into hospital transport available and have had to use ambulances. I want to acknowledge everybody who's been so diligent in ensuring patients are kept safe, but this is a real patient safety risk, and so I've been escalating and working with the ministry and the region to try and ensure that that we get a much safer service as quickly as possible. It's really unfortunate that Nest feels a little bit like it's been dragged into this vortex at the moment. First new Nest helicopter should come on stream before the end of October, which will be great, less downtime, and then there's another Nest helicopter, and then we're hoping for 2 new helicopters in Auckland before the end of the year, so that will make a significant difference, and we're looking at the procurement of a 5th helicopter. So future is looking brighter, but we're having to get through this really difficult time, which has been already a number of months, and there's a lot of staff, both emergency team and support staff within the District Health Board, have worked really hard on this project. Finally, just some discussion about our infrastructure and building program. So, as you know, we've had plans to build a new Whangarei hospital for some time, and that was put on hold because of various earthquake issues, and so the centre of the North Island, or centre southern North Island and northern southern island of the South Island were prioritised ahead of us. We're seem to be back on track now, and that's great because there's been recognition that really our hospital needs significant work, and that work can't be a refurbishment. It does need to be a replacement of the hospital. And so we're working closely with the ministry. Our business case, which was for a really significant 4-storey building, was declined because they want us to build a new hospital and progress that as quickly as possible. We were given 40 million to work on keeping the staff safe and expanding or remodelling where necessary, but the much larger project was declined. So teams are working at the moment on this, but the bigger prize is definitely to get a budget bid in for this coming year for the new hospital, or at least a significant tranche of that new hospital. And so we'll be working really closely with Ministry. We've had a number of visits from various groups, and you may have seen me walking around and touring with lots of people in suits, and the odd person not in a suit, but generally quite significant numbers of people have been through over recent times, all with a lot of influence around decision making, and that's helped significantly, as have various reports that we've provided to them to escalate and to get our priority back on track. So good work from everybody who's been involved in that, and I'm hoping for formal confirmation of some of those details very soon. So yeah, we'll be working with you on all sorts of areas around models of care, building design, etc. And I suspect some of that will take a little while, but we are on a fast track to getting a new hospital, which is great. And at the same time, we've of course also got our other building programs soon to commence. Obviously, endoscopy is well underway towards completion, and we then have 2 new theatres, cath lab, and they will be commencing early next year and completed by either the end of the year or early the following year. And then also some further work needed at Bay of Islands Hospital around primary care and outpatients and renal to complete what has been a fairly long project around upgrading Bay of Islands Hospital. So lots of building work going on, lots of other work, which is great, and I want to acknowledge all of you for all the great work you are doing every day, and we'll talk again following the November board meeting. That will be the last meeting for this current board, and as you know, at the moment we're having local body elections. 7 of our board members are appointed to the board through a local electoral process, and then 4 board members are appointed by the minister. So interesting times for me. Probably really doesn't affect you very much, but it's pretty critical that we do have a strong and supportive board. So we'll know all of that by the next time I talk to you. So all the best, and we'll talk again soon.